Dr Sohail Bhatti was Gibraltar's public health director for much of the pandemic until late 2021. Last September, the Chief Minister presented him with the Gibraltar Medallion of Honour in recognition of his extraordinary contribution. Last week, Dr Bhatti admitted on Viewpoint that something changed in his relationship with the government towards the end of 2020. After his interview, he told GBC he believed solicitors in London had now been instructed by the government or the GHA to issue an injunction or gagging order against the professional regulatory bodies in the UK that might seek to escalate any reporting by Dr Bhatti of potentially life-threatening issues in Gibraltar during his time in post. He's soon due to do an annual professional appraisal, which is required of all doctors registered with the General Medical Council. GBC understands this would be in the UK with an officer from the Faculty of Public Health. Dr Bhatti says an appraisal is meant to be a confidential discussion among professionals. But where issues of potential life-threatening findings are discovered, regulators may feel the need to raise matters to a higher authority. He says the GHA and Ministry cannot hope to improve if they limit honest, open and transparent discussion of mistakes, errors and oversights. Dr Bhatti said secrecy is the enemy of safety, as the airline industry found decades ago. He said reviews and investigations of adverse events are routine in the UK, where the system learns from its mistakes. He alleges that this learning is absent in Gibraltar in the GHA. But in response to GBC questions, a spokesperson for the government said no such action has been taken either as the GHA or as the government of Gibraltar. The government has confirmed, however, that it's instructed lawyers to defend a claim made by Dr Bhatti for what it says is almost £500,000 of additional remuneration. The government says Dr Bhatti claims that he's due this money because he worked long hours during the pandemic. A spokesperson for the Office of the Chief Minister said these monies are being claimed over and above the 20% additional allowance that Dr Bhatti was already paid for COVID-19, which was on top of his salary of over £190,000. The government says it will defend any claim brought by Dr Bhatti. In response to the allegation that it might be seeking to gag the UK professional regulatory bodies that might seek to escalate any reporting by Dr Bhatti of potentially life-threatening issues in Gibraltar, the GSLP Liberal government says it was the alliance that introduced Gibraltar's affiliation to the GMC and the aspects of regulatory benefits that this provides healthcare in Gibraltar. For his part, Dr Bhatti told GBC the sum he's claiming is £440,000, which he believes is fair based on what the acting medical director got paid and the hours that he knows he worked over 3 years, as evidenced by his diary. He stresses his contract was drafted before the pandemic. In any case, Dr Bhatti says the dispute is not about money per se, but about a job plan. The British Medical Association says a clinical contract of employment, such as Dr Bhatti's, should include a job plan, an annual agreement that is supposed to set out duties, responsibilities and objectives for the coming year, including specific pay arrangements negotiated for undertaking extra work. According to Dr Bhatti, his requests for a job plan were repeatedly ignored while other consultants had theirs agreed. His position is that a job plan can be agreed retrospectively, but this has to be based on the work done. Dr Bhatti says the GHA responded to him immediately after his Viewpoint interview on Thursday and says he's surprised that the response is being led by Gilbert Licoudi QC. He points to the frequent contact and extensive interaction that he had as Director of Public Health with Mr Licoudi when he was the Minister for Education, the Port and the University. Dr Bhatti asks, can't a firm as large as Hassan's find someone without that conflict of interest? The government and Mr Licoudi have so far declined to comment on this aspect.